Welcome back to TV5 News at 9. Lung cancer is the deadliest form of cancer, and catching it early can be challenging because it often goes without symptoms. This morning we have Dr. John Kuhn joining us. Dr. Kuhn, thanks for being here.
Hello, thanks for having me.
Yes. So there's an annual screening for lung cancer that a lot of people may not know about. Tell us about that.
So it's interesting. Lung cancer is the #1 cancer killer of people in the world. The United States in particular has had screening tests for cancer forever. Two of the ones that people know about, because there's been huge publicity campaigns, are for colon cancer screening, having the colonoscopy usually at 50. That's actually been, I guess, revised, and so they're recommending you have that even earlier. And the second one is mammography. Thanks in no small part to the Susan G. Komen Foundation and tons of publicity on that. Lung cancer kills more people than both of those combined, and until fairly recently, there's not been much of a push to screen for lung cancer. Part of that is because the test to screen for it used to be more expensive, and part of it used to be that we didn't have that test readily available for people. And that test is a CAT scan of the chest. We've now refined that to the point where we can do what we call a low-dose screening cancer CT, lung cancer CT. And so the CAT scan or the CT scan doesn't use as much radiation to do that, so it's safer for patients. We've gotten it down to, more refinement where it's not as expensive as it used to be, especially a screening test. And we've been able to turn it into a screening test such that anybody with a significant history of smoking, usually 20 years or more, and when we say a year, that's a pack a day for a year, is what we count as 1 year of smoking. That then puts somebody at 50 or greater at significant risk for lung cancer. And it's significant enough that they should get at least a yearly screening CT, and by 50 they should get a CT scan of the chest that will be their initial study. If that's totally negative, then it's up to the patient's primary care provider whether or not to continue that every year or do that potentially less often. But that then catches lung cancer, which, as you said earlier, is asymptomatic, much earlier, in a time when we can then physically cure that by taking it out. And if the patient for some reason was not a candidate to have it taken out, we've got other methods that we can use to attack that and eradicate it, so that people then have a much higher chance of being cured from it, as opposed to somebody having a larger tumor when they present, or the tumor's already spread when they present, and that makes their outlook much less favorable.
And there's also a new biopsy procedure available at McLaren Flint. Tell us what that is and how it's different from traditional lung biopsy.
Absolutely. This is very exciting new technology. It utilizes some existing technology that we've had and combines it with a robotic assistance program that allows us to get way out into the lung, all the way out to the periphery of the lung, that was previously not available without the old style, which was using an X-ray to locate it and then placing a needle through the skin of the chest and the chest wall through the lung to the tumor, which then resulted in a fairly accurate biopsy. But the downside to that is about 20% of the time the patients, if you can imagine, getting a needle poked into your lung, it popped the lung, and then they had air outside the lung called a pneumothorax. Sometimes that meant they had to get a chest tube to re-expand the lung, or even sometimes be admitted to the hospital. So doing it the new way with the robotic bronchoscopy is the name of the technology that was existing, that allows us to go down through the throat, put the patient briefly to sleep, so there's no pain, there's no problems other than the patient just goes to sleep and wakes up and it's done. But we can do two things at once that way. One, we can get all the way out almost anywhere in the lung with that to get a very accurate 90% or better accuracy rate onto getting the biopsy. And then two, if there's any chance that any of the lymph nodes, which is part of your immune system, that catches the cancer cells if they try to spread, we can diagnose those at the same time by getting samples of those as well. And then that can speed the patient on to potential treatment because we eliminate an entire stop on the course of workup, basically. We don't have to have the patient go to a whole nother department, schedule a whole nother test. They can just get everything at once with the pulmonologist, and it really speeds the care, increases the accuracy, and again, helps us cure cancer when it's at a much better stage and much higher chance of us curing it.
Yeah. And if someone is interested in getting a lung cancer screening, how can they get more information on that, and how do they know if they're eligible or not?
That's a very good question because people wonder.
Yeah.
If I smoked a year or two, am I at high risk? Do I need to get it? You know, I'm 60. Does that mean I need to get it? Well, no, it doesn't always mean that. And having that to refer to is very helpful. We have a website, and the website's mclaren.org/Flint lung screening.
Perfect. And anything else that you would like to add about lung cancer?
I think that eventually we need to be able to have some kind of programs like Susan G. Komen Foundation was so successful in publicizing this, and you have 5Ks, you have benefit walks, you have all kinds of different benefit, balls and things dedicated to that to help the publicity and help the public awareness of what's going on with breast cancer. And it's been hugely successful. It would be really awesome if we could eventually get to that point with lung cancer because it's such a deadly disease and affects so many people.
Yeah. Well, doctor, we thank you so much for your time and for your expertise.
Yes, ma'am. Thank you.
Yes. And you can find more information in the hot link section of our website, WNEM.com.